Novelty Health Shine.
Hi, I'm Dr. Jayanthi Reddy. I'm a gynecologist, consultant gynecologist at Hospital Hyderabad. I've been in this profession for the past 32 years. After doing 3 years of my residency at the Government Maternity Hospital Nayapur, which is affiliated to the Osmania University, that is the Osmania Medical College. After that, I have done 2 years of rural service, and after completing my assistant professorship at the maternity hospital, I have now started my own hospital, which is known as JJ Hospital. It is in Hyderabad. My specialty, that is my interest, is on management of high-risk pregnancy, and the vision of JJ Hospital is to impart knowledge to the patients, to give them awareness, and also to give them the treatment, especially the middle and the high middle class people, the treatment which is almost the same and in a affordable way to the middle class people. So that has been our mission, and we've been able to manage it, keeping our prices at a reasonable level and also giving them the best of care. In this regard, I would like to say that we have developed a good ultrasound facility where we can do all the high-risk cases, monitor all the high-risk pregnancies, and also we have developed our endoscopies also. So we can do hysteroscopies, laparoscopies, and all sorts of gynec endoscopic surgery also is being done at our hospital. Now, why is it important that we should concentrate on high-risk pregnancy? Because there is a lot of new knowledge, scientific knowledge that is coming about, and we should be able to give the best of all this scientific knowledge to our patients. And in high-risk pregnancy, why is it that we are dealing with so many high-risk pregnancies today? It is because of the very good infrastructure that is available to manage them in all the hospitals, and also very good NICU facilities that have come up. We are able to manage in our hospital babies that are more than 800 grams. So in other dedicated neonatal units, they are able to manage babies that are more than 500 grams anywhere when they are more than 24 to 26 weeks. So, and another thing is, we are seeing a trend among our girls to marry late, to have children later, and in the process what happens is the resilience of our body comes down. So we find more number of these girls getting diabetic, having gestational diabetes, then having hypertension in pregnancy, pregnancy-induced hypertension, hypothyroidism, and also bad obstetric history, and also because of the bad lifestyles that they are leading, they get into polycystic ovaries, and that again giving rise to hormonal imbalance, giving rise to miscarriages. So all these things forming a gambit, and also metabolic syndrome. So we are finding so many such cases, and we are also seeing a lot of women come to us after infertility treatment. So that again becomes a risk and high risk pregnancy. We are finding girls coming after 35 years, even 40 years, and after treatment for infertility with IVF, ICSI and donor oocytes, so many things. So that is the reason this is a great unmet need is there for centers to reach out to these women and to give them the awareness of all these problems that can occur in pregnancy. And another thing is not to scare them away, saying all pregnancies go keep searching for some problem or the other. No, 90% of the pregnancies, they are low risk, no risk. But there is nothing like a no risk pregnancy. There is either a high risk or a low risk, because we don't know, we may have a low risk pregnancy patient, but suddenly they can be having some antepartum hemorrhage, or they can develop postpartum hemorrhage, and they can suddenly become a high risk condition. But all said and done, with good care during pregnancy, with good awareness, and also telling them, teaching them about the good diet that they have to maintain and good lifestyle. And lifestyle, I always insist that they should have some amount of exercise, because most of the people are having sedentary lifestyle. They just sit in front of the TV. Or another thing is, people think pregnancy is some abnormal condition where they have to take bed rest. It is not necessary unless they are having bad obstetric history, repeated abortions, and it is absolutely indicated. Nobody need to take a complete bed rest. So by doing all these things, they are afraid. People, mothers-in-law and mothers come and ask, can they climb stairs? They can. Can they sit down? Can they squat? So these are all simple questions that are coming about. And can they travel? These are so many questions which are paramount in the minds of our pregnant ladies and their caretakers. So that is very important. If you manage to have a good active lifestyle with some amount of exercise, simple yoga and breathing exercise, so that you can have the good power to deliver and have the strength and the stamina to deliver a normal baby, and also prevent the onset of gestational hypertension. Make sure you do not have any nutritional deficiencies like anemia, vitamin D deficiency. All this again can prevent hypertension. And when all these risk factors have been managed and you are doing your exercises, you are relaxed in your mind by doing the breathing exercises and also meditation, and also talking to your baby in the womb. You create this whole thing. The mother and the baby is one unit. You have to understand there are a lot of conditions like fetal origin of adult disease. And even if you do not give a hostile environment to the baby when it is inside, or mentally and physically as well as medically. If a baby is exposed to high sugar or hypertension in pregnancy, there is a chance 25% that they will develop again hypertension and diabetes earlier on in their life. So it's a great responsibility on us, on the mothers and their mothers, to make sure that we have a healthy baby and give rise to a healthy nation. So it is our responsibility, and in this regard, I am very thankful to Novelty Sciences for giving me this opportunity to bring about this awareness to you. If they follow this knowledge that I am imparting and take care of the diet, their exercises, and have a cool mind, that will cause them to set into labor. And when they set into labor, naturally, there is a chance of having a normal birth. So unless there is a breech delivery, a placenta previa, and there is a baby who is compromised and the blood supply is reduced, there is no need to panic. You can wait easily till your expected date of delivery, which is 40 weeks. many people have this wrong notion that 9 weeks, 9 months is 36 weeks. No, every 2 months we add 1 week. So 9 months is 40 weeks, and at the end of 40 weeks, and if you wait, you can even wait for a week after that. If everything is fine, set into labor naturally, do your exercises in labor, and then you can automatically have a natural birth. And that should be the aim of every woman who is pregnant. And the journey doesn't end there. The journey ends in preparing the mother for lactation, because again the first 6 months the baby has to get exclusive mother's milk. So for that you have to prepare yourself. The nipple exercises have to be done before, and also the baby has to be put to the breast within 1 hour after delivery. It may be a cesarean section, it may be a normal delivery, and when this is encouraged and the mother is given a good diet, and again not overfed, then and create a good bonding between the mother and the child, and given lots of liquids, then there is no problem about lactation. This again is emphasized. We have August 1st 1 week where we are talking about the breastfeeding awareness program. So we have to remember that it all starts pre-conception, during the delivery, during the labor, and after birth. So the first lesson in rearing our children starts with breastfeeding, where your bonding happens, and this is a beautiful lifelong relationship that we should have with our children. Thank you very much.
If you know of any couple who are unable to conceive within 12 months of trying, please encourage them to seek help from medical experts. Let the reach of scientific advances in reproductive health spread to all corners of the country and bring joy to all such couples. This public awareness message aimed at spreading awareness on infertility and its treatment is brought to you by Novelty Health Shine.